yourself.
Yes, yes.
Okay.
Actually,
She actually wants to take it with her.
like in a mason jar.
Well, I'll give you a minute alone with it. But
Okay, that's all I need. That's all I need. Just the amount of time.
Are you excited about this?
I'm very excited.
You are? That's
Yes.
great. That's what I like.
We're popaholics. Like,
Oh, awesome.
I mean, we're like
We'll get you all
fangirling
set
at
up.
point.
Oh, it's good.
We'll get you all the gear and you'll be ready to almost pop yourself, but not quite. You know,
Okay. Oh my gosh, I'm so
So-
excited.
We really are very excited. Thank you for having us.
Thank you so much. Girls are all excited to meet you guys too. Yeah, you guys have that, so come on. Maybe you don't get to put it in your own office.
I actually just stole it.
Yeah, I don't want to show this on your face, but I will. No, we won't post them or anything now. And Spencer in the back.
Yeah.
Spencer's on air time.
This is fun. Oh my gosh.
Okay, perfect. Okay.
Oh, it's there, I guess, you know.
Well, they can see it in the mirror, kind
Like,
of.
you can't reach it.
But they can't get to it.
I can't even zip up my own dress. How are you feeling? I know you got your shot.
Yeah.
The shot was actually relatively painless.
Are you nervous at all?
Yeah, I'm a little bit.
Are you fangirling yet?
I'm fangirling.
Oh my
She
gosh.
said
I know. It's crazy.
I feel like I'm fogging up my.
Actually, or your team is shooting a video for your channel too.
For
right
as
now.
if from our perspective, like
Oh
the
my
how we this is how we
gosh.
do it. This is how we do it. So yeah, be careful not touching too much of this. I
Oh,
gotta say,
got it,
forget it. Yeah, all the blue.
Spencer just said
Come on
he's
this
a
side,
double star.
He is a double star.
Oh my god.
Double star with your double cysts.
Yeah,
Wow.
exactly. So it's like a very what is this? It's called
This
very
is how you
meta.
do it.
Very meta. or
Yes,
something?
very
So
meta.
meta.
Can you lean a little more forward? There we go.
Oh, you can see
Yeah, you
it.
actually lean a little more. You can, they
Where
can
is
see it.
it?
Oh, one more thing. Your feet. Watch out.
Yes.
That little edge. If you hit that, his chair will move. And
Oh
he'll
my
go into
gosh.
his
This
position
is
and
why I'm
stuff.
not.
Flip him upside
So
down.
just be careful with that too.
So why
So
is
if you
it
hear that,
red
if you
at
hear
the
that
top?
sound, like let me just show you. If you hear the sound, that
Yep,
means
yep.
you're touched.
Oh,
You've touched
okay.
it. So just
Yeah.
like try
I'll
to
do that.
move your foot if you hear
Okay.
that. Okay.
Wait, so was it red before? Or did you do something to it?
I just put some numbing in it, and so that's why it got a little bit. I don't think we'll need the copper. We're not going to use it there. So I just put some numbing there. That's why. So every time I put a little pin, a little nick with a needle,
This is so exciting.
and then grab you some of this.
Looks nice and juicy, Spencer.
It looks ready to pop, right?
Is it more of a pop or is it more
This
of like
is a
an
pop.
instant?
These are usually like, if we can get it intact, it's usually a very nice
Oh
pop.
my gosh, I'm so excited.
Okay, so we're gonna just take a little line right over it. Do you want me to lower it a little bit? I can for everybody. It's okay with me.
Oh my gosh.
She just
How are you doing, Spencer?
Good. It feels very far away.
What?
It does. It does. It doesn't feel like anything with him. And then I'm just going to loosen a little bit. This is called like undermining. It's okay. He doesn't feel anything.
Oh,
I think we
listening.
already might have. Tap it again. I think we might have hit the top of it already. Oh, no, there it is. See it? Oh, yeah. Tap it a little bit. Just tap it a little bit. It's okay though. I'm going to actually squeeze it.
It looks really good. Looks
that's
really
when you know
good.
you got to give it a little good squeeze, okay?
Oh wow! Oh my god! It looks like. Oh wow! That's a lot. Oh.
So what
Just
is
gonna
that
pull that away.
exactly?
That is like
Pus?
it's actually skin that has shed out into the sac.
Oh.
So this is the fun part though too, if you can get that little sac and pull it out.
Oh my god. And what is this?
This is the actual Pilar Cyst, the sac that it's held in. Ooh, it's stuck to you. It doesn't want to let go.
Oh my god, Spencer! It's like. Oh my god! It's like a little bean.
Lily, were you holding on to me?
See, so it's like a little
Here you
it's
go.
almost like consistency of like an olive, you know? So
Spencer.
we'll show it to him.
Oh my
What is that? Is that Lily or is that Jocelyn?
That's Lily.
Yeah.
Lily.
You just cut me out of your life,
Yes.
Spencer.
Oh, what's this
Just
other
making sure,
stuff
just
in
making
there?
sure that everything's gone. Am I hurting you?
No.
I love that you do that, by the way. You always
Making
like
sure?
check with your patients like many times.
Of course, yeah, I'm a little neurotic like that.
I think it's
Only for
good,
that
though.
kind of stuff, though.
Zaza, look at Martin.
Oh,
We're pretty much
my
done here.
gosh.
That was, make sure this is trimmed.
That was very satisfying.
Spencer.
And Spencer's also like the most lax patient
Yeah,
you
I
could
know.
ever possibly
He's chill, isn't he?
Can you guys hold Spencer's hand again?
I've seen his videos. See, now it's nice and flat. Look, you can
Oh
see.
my god!
Oh my gosh, it's all gone.
I'm healed. I'm holding
He
it.
did it.
Now that you got Lily out of there. That bitch.
So you have to do little stitches.
Yeah.
Ooh. gee, I've never seen this happen either.
Doesn't have to. Oh, really? Up close?
No,
Fascinating.
You guys are crazy.
we are.
We're really easily entertained, and then you're just actually really entertaining. So.
Oh, yeah, I know
The
it's become
combination.
a big entertainment. I think people kind of gather around and watch these together in groups, right?
What do you
Yes.
What do you hear from people that they love most about watching your content?
I think it's just relaxes people. People
It
wear
does.
watch them to
I
go to
do
sleep,
feel
right?
relaxed.
They make, and you just, I think it's cleansing, and they learn about the patients too. They might not know who they are, but they learn about them. And I think it's fascinating to people that people can, these procedures are being done on people who are awake and alert and are normal.
I think that
You
that's
know?
probably the biggest one for me is that it's crazy that you're like stitching him up and he's just hanging.
Just fix that sit. So we use a blue stitch and we kind of keep them a little long just so that we can find them, because they come out in 10 days. I think.
Oh, and you just pull them out yourself, or just?
He can have them. One of you guys can take out the stitches if you
Really?
want.
Follow
About
up.
10 days.
We're gonna
Lunchy break.
We're gonna do a follow up.
That's it.
Give me a lunchy break one more time, Lily.
Spencer.
Lunchy break.
Oh my God.
That's our vlog show where we eat lunch.
I'm gonna check that out.
And
If you're
pull
ever
out
hungry.
stitches.
You know what? I'm gonna give you the snack to eat at lunch then.
Oh.
Just like a bunch of Pilar Cyst nuts.
Oh, I love to
Oh,
eat that.
take a look at this, Spencer.
Spencer, you ready to
Oh,
see
we
Lily?
squeezed all the stuff out of it. So,
Follow that.
so you can actually, I'll grab you some gloves. So you can touch it with your
Play with
hands, but that's
it.
just weird.
Oh my goodness.
That was in your
That's
head.
inside of it.
Oh, that's where you got it. Like
Yeah,
that.
Oh
see
my
all
God.
the stuff on that was
Ooh.
like shed skin on the inside right there. You see that?
Oh my God, before you touch it, it almost kind of looks like a tube.
You guys want to touch
Yes.
it?
Yeah.
It does look very
Can we
good.
touch it, Spencer?
Yeah, it's
Yeah.
cold now because it's out of his body, right? It's cold.
Oh, but it was warm?
It was warm.
Don't
before.
drop, don't drop Lily.
Oh, I won't.
Be-
I'll
be
be
Do you
gentle.
want a glove, Spencer? So you
No.
can.
He just.
It feels like a piece of corn.
Oh, it does.
Oh, yeah.
You want to wash your hands here?
He does not care. He's
And
like,
it
oh,
looks
Oh, no,
I
it's
love
great.
it.
Oh,
It's your body.
what's the
Oh,
biggest
it's a
one
golf.
you've ever seen? You said a golf ball size.
Yeah, we've had them pretty big like this.
Oh, I wish
big.
I wish
Oh,
Lily
that
was a
must
little
be really
bigger.
painful for people.
I
mean,
they
when
can.
they-
I think
before
that
they-
they
when
can.
they-
I think
before
that
they-
people remove them more likely when they are like on the back of their head, like that one got removed because it was where he leans back, so you always
Yeah.
feel it and you're pushing
Uh-huh.
against it. But I think the ones that get real big are like on the top of your head because you let them.
can't
You're in
feel it as
denial.
much.
Well, no, you're kind of like I can hide it. I can do a comb over and hide it. I don't have to
You can
get
do
this
some
removed.
teasing.
Yeah, it's not like it gets in the way of
Get a
things,
bump
you know,
it.
makes you a little taller maybe,
There
the
you go.
rides at
There it
Disneyland,
is.
that kind of thing.
Oh my gosh, you
That's it.
just killed it. Good job, Spencer.
Yeah, we'll send that in and we'll look at it in the microscope too. We'll put the
Oh,
microscopic
my goodness.
findings on there so you can see what you look like.
Oh, I love
See
science.
my insides.
Isn't it just make you excited to be a dermatologist? Yeah.
Yes.
And you girls, strong work.
Thank
really
you.
good. So we help so
Thank
much.
you so much. This was
You look
magical.
really good in the gear.
Thank
That's
you.
it.
We're halfway there.
It's
That's
because
half
we're
the battle.
completely covered and no one can see us. We look freaking fantastic.